So welcome back to the lockdown approved garage. Obviously, hopefully I'll be back in a regular gym at some point this year. Commercial markets, aren't quite what they used to be, so I'm looking for some good deals. Anyway, so this video we're going to look at the idea of progression in your training, because I think one of the biggest problems I see with people is that they were training and maybe playing sport, whatever it may be. They had a back issue, and okay, so obviously your first thought is that, right, I need to go into rehab, and I'll start doing sort of low-level rehab type work and get a bit of an improvement and kind of get on the right track. But then all of a sudden they'll jump straight back into what they were doing before, and everything's just going to fall down like a deck, like a house of cards. It all just crumbles down again. The reason behind that is because there's a bit of a gulf, and there's too big of a difference between the sort of low-level rehab work and the demands of low-level rehab work and versus what they want to do, which might be, say, back in the gym, say for example doing things like deadlifts and squats, or it could be back on the field playing sport or doing something like jiu-jitsu or judo, whatever it may be. So when we first start with sort of rehab and injury, we need to acknowledge the fact that we're down here in terms of demand and skill level. Where we want to go is over here somewhere. So we can't just sort of do this and then try and jump that big gap to here and hope it's going to work, because it isn't. We need to methodically, step by step, build our way up. So again, this is where the idea of the bank balance comes into play. So obviously when you first start with rehab, you're just trying to give yourself enough bank balance to get through a basic day, which could be just $100 just to sort of go to work, be with the kids, do the things you need to do. And then if you want to get back into training, you might need more like $200, and if you're getting back into competitive sport, it might be more like $300 in that bank account for your back, to make sure that you're safe and you don't re-injure yourself. So what we'll do in this video is have a bit of a look, bit of a brief overview as to how you would go from the low-level stuff and what I mean by low-level rehab stuff, and then kind of give you a bit of an idea of how the puzzle pieces together to get you back to where you want to be, and an idea that you don't want to rush that process. You're going to be very methodical, brick by brick, step by step, get yourself back there. Okay, so low-level rehab work, what do I mean by that? So this is our first step, our first destination on our rehab journey, if you like using that term. So for most people, I'd say if you've got back injuries, a good place to start for most, but not all, is the McGill Big Three. I think if you can get not just competent, but you can master those three exercises, because it gives you stability for your core and your spine in the three planes. So very simply, forward and back, side to side, and twisting. That gives you a good base and foundation to build from. So what you're doing with your training at that point is you're identifying components that are missing or not quite up to scratch, and you're working on those individual components. So what are those exercises? So we've got the McGill curl, which again is that sort of forward and back stability. The key with this is really we're trying to learn how to utilize a brace but not change the posture of a lower back. So naturally your lumbar spine's got a natural sort of dip in it. What we want to do is fire that brace as hard as possible without changing that and putting the back into a weakened position. So what we're doing is we're teaching our core muscles to kind of come together and brace that strongest position for our lower back. Also, we need to learn how to separate our brace from our breathing. So obviously a lot of people, when they've got back issues, they try and brace, they go, oh! Try to hold their breath, which is no good because you can't do it for very long, and also it's a very inefficient way of doing it. Now, having said that, later on, once you've got the basics of a brace, you can add on intra-abdominal extra pressure with sort of using a diaphragm and squeezing air on top. But again, that's later on, and that assumes that you've done the work with the brace to begin with. So McGill curls, and then obviously we look at things like your side bridges. So side bridges, again, is that lateral, that side-to-side stability, which, if you want my opinion, that's probably the one I see that a lot of people with back issues struggle with the most. And it also tends to explain why they've got one tight hip versus another, or if they're really bad, they have a flare, they kind of buckle over. So level 1 side bridges, what we're looking at there again is teaching the core, particularly like the obliques and the QL, to really give us that stability to stop our hips from dropping to the floor. Again, very important skill, but also something that people don't tend to mention or don't understand with the way that McGill does the side bridges, and what I would say is probably a very important aspect that gets glossed over. If we look from the side, at a level 1, level 2 side bridge, if you look at it from the side, because it's got that dynamic component, so obviously we come up for a 10-second hold and then we push back. The way in which you push back, if you look at it, is actually a squat. So already, although you're doing low-level rehab work, we're already starting to get your body to understand how to utilize a strong set core separately from your hips and your legs. And again, that's the key thing, is better control these components and separate it from hips and shoulders in particular, so you can set your shoulders to your hips and your arms and legs can do whatever you want to do, and it doesn't disturb that core. Because again, the way a lot of people compensate is by using guy wires and locking down stuff that shouldn't be locked down to try and compensate for that lack of stability. So again, think about the side bridges. That's really, it's starting to build your squat. So if you're working on side bridge level 1 from day 1, you're already starting to work on a squat pattern. And we also got in the level 1 stuff as well, and level 2, we have the McGill bird dogs. So again, a lot of people have seen bird dogs before. I think they're quite popular with sort of people who do Pilates and yoga and that sort of stuff. The key with the bird dog, and I cannot stress this enough, is the setup. So if we think about what is the point of doing a bird dog, and again, this is a good idea to think about all the exercises to understand the point and the goals of the exercise, and that helps you get the technique correct. So with a bird dog, obviously, say level 1, we lift the arm up. Obviously, as we lift the arm up, the body, the shoulder and the body naturally wants to fall to that side because you've taken away a base of support. But like a table, if you kick out one of the legs, it's going to fall that way. So we have to resist that rotation somehow. If you haven't set yourself up correctly, you're just going to do that work with your back, which completely defeats the object of doing that exercise. And usually if someone says to me, I'll say, oh, have you done bird dogs before? And they go, yeah, I find them quite easy. That is a massive clue to me. If they find them easy, they're not doing them correctly, because they're never easy. You get slightly better at them, but I would say at the 3 exercises, they should be physically the most demanding, because you're having to put together the components of the forward and back stability and the brace from McGill with some natural stability, and then you're adding on rotational stability at the same time, and then trying to extend an arm and a leg. It's actually quite a demanding exercise. So the key with it is the setup. So again, it's making the shoulders are set up, the brace is set up, and then you're ready to go. So again, if you understand the goal of the exercise, you're more likely to do it. And again, when we talk about separating the core from the arms and the legs, again, if you look at if we look side on to a bird dog, it's almost like a standing press. So it's separating leg drive and movement from being able to extend your arms all the way up and have it not affect your posture. So again, if we can build control for all that range of movement in the shoulders and the hips, the legs and the arms, then there's a good chance we're kind of giving you good core control in most exercises that we'll ever need to do. So that's just sort of level 1 stuff. That's what we call your low level stuff. So that's kind of that's the traditional way of doing it. It doesn't work for everybody, but I'd say for most people out there, it's probably where you want to start. And again, the goal is don't just go through the sort of the rough steps with it. Like, you've got to learn to master all those exercises to get the most out of them. Stage 2, again, take this kind of structure with a grain of salt. Isn't going to work for everybody, but if you were going to ask me what a traditional approach would be, it would be kind of securing stability around the core, neck, lumbar spine, and then starting to work out from there. Again, doesn't work for everyone like that. Yet sometimes you have to kind of change things, but again, that comes down to me, in my regards, being a good coach. I'm going to notice if that's not the right approach for someone or where I need to change. But understanding how a basic progression might work will give you something you can sort of fiddle around with and adapt as you need. Anyway, so level 2 sort of stuff, I guess, is I would start to sort of branch out into sort of the hips, particularly the glutes. So gluteal amnesia and lower back pain are obviously sort of hand in hand for, again, most people, not all, but the vast majority of people. So then we would start to look at, if that's an issue, what are the exercises that we can use to start to restore that component? So using your glutes to be able to extend your hips and obviously give you some stability to your leg as well. So my sort of favourites, again, doesn't work for everyone, are things like Dr. Lock clams. I think work very well, and you can sort of progress those by adding a band as well for extra resistance. Prone hip extensions, a very important exercise. Being able to extend your hips by using your glutes and not try to cheat by using your back or your hamstrings is a very important skill to have, particularly if you want to get back into lifting weights without smashing your back to pieces. and or getting back into sport. Again, sort of people that sort of tended to back in with things like squats and particularly deadlifts, I can pretty much guarantee you that you're doing most of the work with your back, and your glutes aren't really helping you, get that extension that you need for your hips. So, probably hip extensions, very important skill. So, once you've got that those sort of basic components for the glutes, which is hip abduction, external rotation when we work the clams, and obviously hip extension with the prone extensions, then we can sort of put those two together into a glute bridge, which again, once we've got a base with the basic glute bridge, we can sort of add a band to it, add weight to it, and kind of build from there. So again, being able to extend your hips and use your glutes correctly is an extremely important skill to have if long-term success for your back and being able to return to training and performing well. If your glutes don't do much, it's going to be a very hard fought battle, and you're just going to keep re-injuring your back all of the time. So yeah, getting the hips. So level 1, set the lumbar, set the basic core control, then working into the hips using the glutes, getting those back into doing something useful for you. And then we can sort of now, we've got the components in place individually. It's a bit like I like to think of it like an orchestra. So, you've done a bit of work on, your rhythm section, done a bit of work on your brass section, on your woodwind section, your choir, all these sections individually. So now really when we sort of talk about sort of level 3, we need to start thinking about how we integrate that. So basically what we call tuning up the band, how do we put the orchestra together and get them to start playing the same song at the same tempo, at the same volume. 3, we've got all the components in place, we've got the individual pieces of the orchestra working on their own. Now let's put them together, get them tuned up, play the same song, same tempo, same volume, so that we make sure that the back isn't doing all of the work all of the time. So what are sort of your level 3 exercises. So I quite like things, I like to sort of introduce some kettlebell work at this point, but also just basic things like a modified sit-down squat works very well, especially if you can have the weight, if you can, obviously depends on your shoulders, having the weight kind of off-center by holding a dumbbell out in front of you, and then also having a band around your legs as well to make sure we're getting the cueing for the glutes can help, can work wonders. So again, being able to sort of sit down and stand up again without throwing your back out is a very useful skill to have. So, I even use this for people who just want to be sort of fit for day to day. I'm not even specialising really in stuff at this point that's to do with someone who wants to get necessarily back in the gym. But this is definitely like minimum. Everyone who's got a back issue, if long-term success is what you want, I assume it is, being able to sit down and stand up again without throwing out your back is definitely a must-have skill. So, modified sort of sit-down squats to like a bench or a stool or something similar, about knee height. And then when you're ready, you can sort of take that away and then sort of do it in space. That helps, work wonders with that sort of, again, that next level progression. So you've worked the individual components, and now we put them all together for that sort of next stage. Also, we can start looking at things like a hip hinge movement. So a kettlebell RDL at this stage is probably going to be a good, again, not for everyone, a good addition. Also, as a side, if you're somebody who's got young kids or babies, you need to get out of a pram and cribs and things like that, you should be an absolute master at kettlebell RDLs, because that's going to give you the strength and robustness in the hamstrings and the lower back at the same time, and also the mobility in the hamstrings to be able to bend over awkwardly over something like a crib or a pram, pick your child up and not throw your back out every 5 seconds. So a kettlebell RDL, I would definitely recommend that to anyone who's got sort of young kids. But again, for everyone else who's just sort of in the sort of stage and process, what we're trying to do really is over-engineer the amount of mobility you've got in your hamstrings and the ability to control your hips for as big a range of motion as possible. Because if I know you can do a really good RDL, then it's not going to be your hamstrings that's going to hold you back on things like a deadlift or a regular squat. So it's almost like we've over-engineered it to kind of make sure that's not going to be a problem going forward. But I think they're a great exercise. Even if you just sit down a lot for a job, a kettlebell RDL will work wonders. If you tend to have tight hamstrings, that's going to be one of your go-to exercises, and one that probably should be in your sort of repertoire regularly, more so than trying to stretch out your hamstrings, which for most people is generally a waste of time because you're just chasing your tail. When we have like an active stretch, like a kettlebell RDL, we're actually strengthening the hamstrings, and we're also encouraging the nervous system to know it's okay to let that muscle be strong for a big range of motion. Therefore, it's not likely to be as tight day to day. So we've got a modified squat, we've got an RDL, that's your sort of level 3. Now we can sort of up the challenge again when we get to level 4. So level 4, what I would start to do now, instead of using like a bench or a box or whatever it may be to sort of limit the range of motion of the squat, what we can do now is take that sort of crutch away, possibly take away the band as well, maybe use a bit slightly heavier weight, so maybe like a kettlebell for like a goblet squat or something similar, and then let you sort of play around with nailing down a technique that you know is safe, particularly for your hips. So we all know, or we should know, that ultimately your squat depth is limited by the structure of the bones involved in your hip joint. So, you know, tight muscles, I agree, you can sort of stretch or mobilize, or joints you can stretch and mobilize, but at the end of the day, you can't get out of bone hitting bone. So that's going to be your big limiting factor. So already you should have an idea of kind of where your stance should be for your hips for your modified squats. So, you know, we can sort of play around with that, and then we can work out, okay, what's going to be your maximal depth at this point, and what's going to be the right technique for you. So I think a sort of a goblet squat, having the weight in front, works very well for most people. Really makes you want to use, you know, brace your core and keep it tight, and you can very slowly start to groove and learn a safe squat pattern for you and your hip structure. And then what we can do, which I like to add on top of that, is then we can look at starting to really build a proper deadlift technique from the floor. So, you know, a kettlebell face the wall deadlift can work wonders for people. So again, being able to pick something heavy and awkward up from the floor safely is a very important skill, even for people in sort of day-to-day life, let alone the people that want to go to a gym and do actual things like, you know, deadlifts, or maybe like a sport like jiu-jitsu where you get caught, you know, on top in someone's guard. They're trying to break your posture and you continuously have to reset and keep your posture strong. So again, those two exercises, I think they're a good choice for, again, not everyone, but most people. And again, it's that sort of next stage. We've kind of increased the range of motion. We've taken away one of the crutches. You've got to learn to control yourself in space and time a little bit better for a bigger movement. Again, that's sort of the next stage on. So once we've got those, then we're pretty much ready. So then sort of jump back into sort of regular, what we call gym work. We're looking at getting you, almost getting you basically pretty much back into what you were doing pre-injury. So the movements and exercises, you know, and the training that you were doing, albeit with obviously a better understanding of the technique you should have and more control over the individual components, and then working together to help you generate strength and performance, and obviously avoid another flare-up and an injury. So now we can start looking at like a traditional, you know, I'll use deadlifts as an example, you know, traditional sort of barbell deadlift, whether it be purely from the floor, or maybe it might always be safe for you to sort of do it raised up on, you know, blocks or weights or pads, whatever it may be, just to give you a little bit of safety buffer. But I like using deadlifts because they're a fantastic exercise. However, you know, they've got a high reward, but also they've got a fairly high risk, probably the highest for most people who've got sort of back issues. Be able to control something from a dead stop on the floor, stand up and put it down again without slipping into your, you know, if you're flexion intolerant, for example, slipping into uncontrolled flexion with a load of weight in your hands is probably the biggest challenge. But again, it could be a very useful skill. Again, not for everyone, you know, but I think for a lot of people, if you can pick something off the floor safely, that's a very good, useful skill to have. So with a deadlift, obviously, you know, don't be afraid at this point now. You've got the individual components, but also try different techniques and see what sticks best for your body shape. So whether that's a traditional deadlift with your sort of, you know, your legs inside your hands, or more of a sumo style, or maybe even like a hybrid kind of in between the two. A lot of it is just finding the right stance for you, your hips and your legs. It's all to do with sort of lever angles and lengths and your body shape, you know, the length of your torso versus your arms, at the top of your legs, the way your hips work. So don't be afraid to play around with them and find out what gives you the kind of the best groove. When you've got it right, it should feel, once you've done your deadlifts, you should really feel, you feel good, like you've done a good movement, you feel pretty solid. If the back feels super fragile afterwards, or the day after, or 2 days after, it's probably something wrong still with the technique, or it's not the right technique for you to kind of use. Again, that's our sort of warning system. If you feel the back has done too much work and is a bit delicate for a few days afterwards, it's probably not quite the right technique. So again, I like to think of people, rather than just chasing numbers and reps, chase good quality movement and make sure that's reinforcing the strength and the robustness that you actually want, not trying to break it down all the time. So again, this stage is, if going in the gym is your thing, something like a deadlift this is the time to introduce it, because you've gradually and methodically worked your way towards it. But again, if you're in sport, you might necessarily need to be doing deadlifts. There might be stuff that's a bit more applicable for what you need to do. So again, that depends, but that's where you sort of, you kind of build a foundation, and once you've got sort of, stage 2 or 3, people start to diverge based on what their goals are. So, someone who wants to be pain-free day to day is going to be different to someone who wants to lift heavy in the gym, which is going to be different again to someone who wants to get back to a particular sport. But if you've taken a sort of methodical sort of steps there, then you're probably 3/4 of the way there already, and now this sort of, this last layer on top has been a bit more specific to your goals. But again, the most important thing is, the rehab work when you're injured is here. Your goals and your abilities that you want are up here somewhere. So don't just try and jump from one to the other. Have a methodical plan and step-by-step progression in place to get there. And that's how you're going to keep those, get to your goals, but also maintain and keep it for the long term, and not just keep bouncing between being injured and having to rehab, back into it, rehab, back into it, rehab. So be methodical, plan things out, think about what you're doing, and don't take anything for granted. So work on the components first, put the components together, and then learn to use all those components into whatever it is that you need to be able to do.